fellow members of the press, fellow Kenyans, the Council of Governors' attention is drawn to recent reports in the media on massive theft of cancer drugs of over 4.6 million Kenyan shillings at our premier National Teaching and Referral Hospital, Kenyatta National Hospital. These reports are suggestive of well-orchestrated efforts to deny Kenyan citizens their realization of right to health, primarily by people entrusted with the duty to care for these patients. These incidences are unfortunate and most disheartening, and I must thank the Fourth Estate for bringing the attention of Kenyans and the world at large to these very unfortunate incidences. But we are afraid that although reported as incidences, they may be unfortunately characteristic of what might have been happening in that national hospital for a long time. We as the Council of Governors condemn in the strongest terms possible the inhumane actions that negate the ongoing reform initiative by both the national and county governments to make access to quality essential medicines and medical supplies a right for all Kenyans at all times. It is important, ladies and gentlemen, to note that the burden of non-communicable diseases in the country has been rising. Cancers account for the third largest cause of death in Kenya, after infectious and cardiovascular diseases. Every year, an estimated 42,116 new cases of cancer are reported, with the number of cancer deaths estimated at 27,092 annually, as documented by the International Agency for Research in Cancer, Globacom report for the year 2020. No doubt, therefore, the health and economic burden attributable to cancer in Kenya is enormous. Families have been driven into poverty from high out-of-pocket payments for health care, especially for cancer. Standard costs of treatment for most common cancers in Kenya remain out of reach for most Kenyans. In this regard, the Council of Governors condemns what has been reported in the press regarding the theft of essential and expensive cancer drugs at the Kenyatta National Hospital. The facts are as follows. 1. The theft was rampant in the private wing, the intensive care unit, and the cancer center. 2. Medicines lost on transit from pharmacy and stores to the wards is a characteristic form of theft of these drugs. 3. A syndicate involving porters, security and healthcare workers has been identified to be involved in these thefts. 4. The patients are denied care due to such evil practices by health personnel who have been sworn to essentially discharge their duties ethically. 5. In the meantime, the culprits have not been punished, notwithstanding some report that people in ICU have been denied their medicine and counterfeit medicine given to them in this premier hospital in the Republic of Kenya. We therefore call upon the Minister of Health to do the following. 1. Establish systems to curb the theft immediately. 2. Enhance systems to enable end-to-end visibility of the use of all drugs in the hospital. This is very easy. It can be done by a much more efficient ICTV system. It can be done more efficiently by making sure that the transmission is governed electronically, so that when drugs leave the pharmacies to the wards, it is something that can be followed without any human error. 3, improve supply chain infrastructure and information system. And finally, to ensure that there is no conflict of interest of those who manage the cancer unit at the Kenyatta National Hospital and private facilities, since it has been reported that the stolen drugs are taken to one such facility owned by a senior official at the Kenyatta National Hospital Cancer Unit. We'd also like to add that it is urgent to invest heavily in the development of human resources at the Kenyatta National Hospital, especially cancer specialists, equipped by the most modern tools for the diagnosis and treatment of cancer. Now, ladies and gentlemen, on another note, equally important, allow me also to address